Welcome to Caravel Autism Health Parent Orientation Part 3. Staff are required to maintain professional conduct at all times. Caravel Autism Health's expectations of professionalism include, but are not limited to, the areas of personal appearance and appropriate attire, therapeutic practices, written and oral communication, conflict resolution, and personal presentation. Caravel Autism Health is required by law to report any known or suspected child abuse or neglect. Staff are mandatory reporters and are required to report things that greatly impact the child and his or her behaviors. Caravel Autism Health is also required to investigate all allegations or incidences of caregiver misconduct, including abuse of a client, neglect of a client, or misappropriation of a client's property. The helpfulness of our clinical programs is enhanced when the child understands the role of staff in his or her life. While we strive for your child to have a positive rapport with their staff and look forward to seeing them, it is also important that your child associates each staff with a learning experience. To help maintain these boundaries, your child should not think of staff as their babysitter, family friend, etc. Also, staff should not participate in social activities with the family, such as birthday parties, family parties, outings, or meals not pertaining to therapeutic goals. Staff will begin work duties immediately upon arrival at the home. If staff is going to be late, it is the staff's responsibility to call the family and let them know. To ensure we are providing professional and quality treatment, the following activities are prohibited. Babysitting by staff is not allowed, as your child may become confused of the role of staff and this could affect progress in therapy. Staff may not clean up of your child's bodily fluids. Parents or guardians are responsible for cleaning all bodily fluids, including toileting and diaper changes. Staff may not administer medication. Parents, guardians are responsible, and this also includes application of sunscreen, insect repellent, and bandages. Friending between staff and family on social networking sites is prohibited. This helps us maintain a professional relationship. Under no circumstances it is allowed for staff to transport a child without permission in advance by the lead therapist or clinical director. Exchanging gifts between staff and families is not allowed. Per Psychological Ethics Code, it is not permitted to give gifts to staff. However, gifts of no monetary value, like a child's drawing, photo of your child, or homemade crafts are permissible. Posting therapy video or audio online is prohibited. We request that Caravel Autism Health not be identified in any YouTube or other social media mediums without permission from the Clinical Compliance Manager. Information about the children and their families within our program is highly confidential, and we adhere to all Health Insurance Portability and Accountability Act laws. We do not discuss your child, their diagnosis, behaviors, programs, or progress with anyone outside of the organization or anyone within the organization who does not have a need to know for billing, treatment, or administration of our programs. Staff is trained to never mention children's last names, addresses, school, placements, or case histories, or any other identifying information. Behavior technicians are not to discuss program concerns or ideas with parents. If parents have questions or concerns, they should ask the senior therapist. Please answer this question. I can expect that all Caravel Autism Health staff will maintain professional conduct and confidentiality. The answer is true. Caravel Autism Health staff will always maintain professional conduct and confidentiality. Caravel Autism Health Cancellation Policy. We ask for a 24-hour notice to senior therapists to cancel their therapy session if possible. If cancellation occurs, staff will try to make up time lost. Hours cannot always be made up due to staff work schedules and outside other work responsibilities. Cancellations due to illness. Therapy should not take place if your child or staff is unusually lethargic or irritable, in the contagious stage of a communicable disease, has a temperature of 100 degrees or higher, has unexplained rash and not obtained release from healthcare professional, has open skin sores or scabies, has diarrhea or been vomiting within the last 24 hours, has discharge from ears or eyes or profuse nasal drainage or congestion, has head lice, nits, bedbugs, fleas on hair, scalp, or in home, and have not obtained written release from health or related professionals. Please note this policy also pertains to Caravel staff, and any household member with these symptoms cannot be present at a therapy session. Please answer this question. I have reviewed and understand the Caravel Autism Health cancellation policy information that has been presented. Other types of cancellations. Inclement weather. Safety comes first. Extremely bad weather conditions which make travel hazardous may cancel therapy. Families will be notified prior to the start of therapy that day. Cancellation by staff. Staff and senior therapist will call you. Staff will call other team members to see if another staff can work that shift. Staff is responsible to reschedule. More other cancellations. What happens if a staff member doesn't show? Promptly call your senior therapist about this cancellation. What if a parent or adult cannot be home for therapy? Caravel's policy is that an adult 18 years or older must be at home at all times unless approved by a clinical director. If not approved and no adult over 18 years of age, therapy cannot be conducted. There may be circumstances where services are put on hold. The decision to put services on hold can be initiated by you or by Caravel Autism Health. A family has the right to put services on hold, and it is our policy to respect that choice. However, Caravel Autism Health reserves the right to decline reinstatement of services. Prior to services being placed on hold, clinical staff will work with you to complete necessary documentation. To resume services, you will need to contact the intake coordinator to determine if services can be reinstated. Please note, there is no certainty that services will resume with the same staff. Some reasons for services placed on hold by Caravel Autism Health include refusal to follow therapy recommendations, excessive therapy cancellations, verbal abuse to staff or threats of litigation, disputes of fees which appear just and normal, display of threatening, hostile attitude, safety of staff is in jeopardy, lack of home cleanliness that affects working space, refusal to pay, or loss of funding. What happens next? If you are ready to move forward, your intake coordinator will work with the clinic to schedule a baseline assessment appointment to create a treatment plan for your child. When treatment plan is completed, it will be submitted to your insurance. Your insurance can take up to 45 days to return authorization with the number of hours your child can receive therapy. Once Caravel receives the authorization from insurance, your intake coordinator will contact you to let you know how many hours per week of therapy were authorized. The clinic will then begin building your team. A senior clinician will reach out to you to schedule an initial visit, and then we can begin in-home ABA therapy. Thank you for completing Caravel Autism Health's parent orientation. We look forward to working with your family. Please continue on to the next page to send an email to intake that you have finished the parent orientation. Please email your intake coordinator and indicate your interest in moving forward with in-home ABA therapy with Caravel Autism Health. Please indicate A, I agree to the terms outlined in the Caravel Autism Health Parent Orientation and I am ready to move forward with treatment. B, I have some questions and would like my intake coordinator to contact me before moving forward. Or C, I do not feel that in-home ABA therapy will be a good fit for my family at this time. Please see the emails below for the appropriate intake coordinators and let them know that you have completed the parent orientation. Thank you very much and have a wonderful day.